Hello, good morning, and welcome back to another episode of Recharging the Human Battery here on AM 950 Radio. Dr. Sinacropi had other commitments today, so you have me, his trusty co-host, Mandi Dickey, nurse practitioner. So if you've been listening, watching the last few times that I have the show by myself, I've been doing the ABCs of concussion. So today I'm tackling letter C. So I'm bringing that back for my TBI takeover for today. And again, why I'm doing this in the middle of all the other topics that we talk about. We have so many great topics that we cover on this show, but I think concussion has been near and dear to my heart after my own accident, obviously a year and a half ago. But I'm realizing that we just don't talk about it enough. And Dr. Sinacropi actually had a post on LinkedIn recently where he talked about concussion. He has this newsletter that he puts out. And he was talking about how student athletes, the numbers that we see reported for concussions are fairly low. You would think it's probably higher than it is. But when you ask the students whether or not they've had concussions, their level went up a little bit higher than the coaches reported. But then when you ask the students if you've had X, Y, and Z as the symptoms, they all reported the symptoms. And the reporting numbers went from like 10 to 15% to like 47 to 50%. So it's this huge disconnect between what people think is a concussion and what people actually report as a concussion. So there's a lot of information that our numbers just are not reflecting the true settings of what we see with concussion. So concussion, TBI, I'll use those terms interchangeably. Concussion in its mildest form has very few symptoms, lasts very little. Concussion in its more severe form, we call that a TBI, and it can be all the way up to the bleed type that I talked about last time in the B letters. So today for topics, I have things like cognitive fatigue, concentration, coordination, and even some of those bigger complex topics like coma and complex chronic traumatic encephalopathy, CTE. So some of those are the topics that I'll be talking about today. I'll intermingle some of the less daunting ones with some of the more scary ones as we go through this episode today. But I'm excited again, just think back, if you have some of these symptoms and you're not sure why, could you identify something that might have been the cause of a concussion? Have you been told you have a concussion, or does a loved one you know have a concussion and you're not quite sure why they're behaving the way they are? These symptoms could be that explanation. And for some of them, I'll give you descriptions of what to do to how to manage it. For some of it, it'll just be a conversation of what it looks like and what the relationship is with the general population. So before the break here, I'll start in with cognitive fatigue, just because it is a little bit bigger. I'll kind of tease you with it, bring you back after the break and talk about it more, and then we'll get more into the rest of them. So cognitive fatigue, I did talk about this a little bit back in the A episode. So if you want to go back and listen to that one a little bit more on activity intolerance, this is the same definition of why we see cognitive fatigue. So this is where we see that mitochondrial energy deficiency. And this is mental exhaustion or brain drain that occurs with even minor cognitive tasks. So it doesn't have to be a big, serious conversation that drains your cognitive abilities. It can be those minor cognitive tasks, things that you just have to make a decision on what you want to eat at the restaurant, make a decision on which clothes you're going to wear in the morning. That could be enough to set you into cognitive fatigue if you are experiencing these severe effects of a concussion. What can it look like other than that? It can just look like slow processing speed, difficulty concentrating, which I'll talk to you about in a moment when we come back from the break, and then trouble remembering things, and just generally feeling like you're being drained on a regular basis. So that's just a teaser of what we're going to talk about on the other side of this break. We'll see you back on AM 950 Radio here. Welcome back from the break. Here we are again on AM 950 Radio with Recharging the Human Battery. I'm your co-host today, Mandi Dickey, solo, talking about concussion ABCs again for my TBI takeover. Concussion ABCs were on letter C if you've been following along. So today I just started talking about cognitive fatigue, giving you a little bit of a teaser before the break, what it looks like. Again, that mental exhaustion, brain drain, slow processing speed. I talked about the kind of the mechanics of it, the mitochondrial energy deficiency back in letter A with activity intolerance. This also can look like brain fog that I talked about deeply in letter B. There was one NIH cited research study that I wanted to kind of just talk about for a moment in traffic related mild TBI. So mild TBI, you'll see that one abbreviated in research as little m TBI. With mild TBI, that's the people that didn't lose severe consciousness. They weren't out of it for a long period of time. They didn't have head bleeds. They didn't spend time in an ICU. That's where we fall into that category of mild TBI. 23% of those patients in traffic-related mild TBIs did not recover within a year, with the majority of those being cognitive disruption when they still had symptoms beyond that year's time frame. So we always talk about how these concussions should clear up in a month, right? That's kind of the number that they always tell you. A couple weeks, 2 to 4 weeks, you should be healed. You should be back to normal. 23% of these mild TBI cases, so that would be a moderate concussion and above, did not recover within that first year. So that mild TBI that we call it isn't really mild after all because it affects people's lives for so long. Here I am a year and a half later with my quote unquote mild TBI. That same NIH report identified that up to 50% of these individuals can have long-term cognitive changes after a single TBI, with worse outcomes after they have recurrent injuries. So this cognitive fatigue is a serious issue, and that's probably one of the biggest ones that we see. When I see consults coming into hypercharge, they're complaining about their cognitive abilities, not being able to think, comprehend, concentrate like they used to. Those will be things I talk about coming up here. So that cognitive fatigue makes it difficult to engage in social activities. So I always kind of joke that being around people is too much. It's too people-y out there. It's too loud. It's too overstimulating, too everything when you have this cognitive fatigue, because any little bit of information that you have to make decisions on is going to be too much for your brain. Stress increases cognitive fatigue. And when you're recovering from a concussion or TBI, you are stressed about finances. You're stressed about whether or not you can get back to work. You're stressed about whether or not you can take care of the things around the house. So all of those little stressors that you have on a regular day-to-day basis will make those cognitive symptoms worse. Yay, right? And that's both emotional and physical stressors. How do we manage this cognitive fatigue? There's not a lot of detail out there on how to do this, but rest, pacing yourself, cognitive rehab. And for those that are not quite aware of who does this, it's speech therapy. So we typically think of speech therapy as helping us with our language, but your cognition is part of your language. So that cognitive workout, that cognitive exercise also comes from speech therapy. Stress management is really important. Other ways, how can we treat it? Improving the health of your mitochondria. It's a mitochondrial deficiency to begin with, so improving the health of your mitochondria. Go to places like hypercharge therapy, hypercharge wellness, where we have the photobiomodulation. Photobiomodulation treats mitochondrial fatigue. That transcranial laser, neurofeedback, TMS, transcranial magnetic stimulation. That's going to be something else that we'll talk about eventually on this show. I'll have it on my podcast as well. But all of these different things, whether you come to hypercharge or not, find someplace else that has it, these treatments do help the mitochondria to heal, to correct themselves so that your body has the energy so that the rest of your body and your brain can heal as well. Next topic related to that then is your concentration. So again, as I talked about in that A episode, sometimes lack of concentration feels like ADHD following a concussion. Now, there is an increased risk of having ADHD, being diagnosed with ADHD following a concussion and TBI, and it's because of these symptoms that we see. So we have changes in being able to concentrate, especially when other things are happening around you, as I was just talking about with the cognitive fatigue. All of those things become very difficult. I personally just redid my neuropsychological testing recently, and the psychologist who did my exam said that I did, quote, adequate in a quiet environment when there were no distractions but she guessed that I would probably have a more difficult time in a busy situation where there's a lot going on. And I can absolutely validate that, because if I'm in a restaurant for having dinner with my family or getting together for the holidays, we're in the holiday season, we get together with our families for the holiday. When there's too much going on, I get overstimulated. My brain can't think. I can't concentrate. I can't even choose what food I want to put on my plate at that point. So there's so much going on. Trying to manage that in a busy work setting would also be very, very difficult. If I have to try to read something, such as signing a document in clinic, or something that I have to read and sign, it's very difficult to do that if there are other conversations happening around me at the same time. So I typically have to go to a quieter area, work on that, and then bring it back, whether I'm being a patient or the caregiver at that time. Multitasking goes out the window when you have a concussion. I kind of joke that tasking is difficult, but it is. So when you are asked to multitask, then do more than one thing at a time, truly there's a lot of research to show that none of us are great at multitasking anyway. But once you have this cognitive fatigue, you have concentration issues following a concussion or TBI, that multitasking gets even worse. So essentially non-existent for some reason. Some strategies that you can find to work on this problem with concentration: using reminders. I set reminders for myself everywhere. I have alarms on my phone for just about everything that I do. Work in a quiet space, read out loud if you can, and practice meditation and mindfulness. Those things will help with your concentration skills. And I will agree with these to some extent. Setting reminders is an absolute must. Like I said, I have reminders for everything. That this is not so much for the concentration part as for the memory part for me, because I don't remember to do things all the time, so I'm setting those reminders. The concentration, I don't feel like personally, though, setting those alarms are helpful for that part, but it does help with that my lack of memory on that part. So definitely helpful there. As far as working in a quiet space, that absolutely can be helpful, but as a parent, uh, I ask any of you out there, have you ever found a nice quiet spot? Because even when you're in the restroom, your kids tend to come and knock on the door and talk to you. So there's not really a quiet space at home either. And then do you really feel like you're present? So that gets into other issues that cause more stress that we'll talk about in other letters of the alphabet. But quiet spaces aren't always available. And even if you're trying to work, if you're working from home, you can't be alone at work. There are always going to be distractions to some extent. So that's where we need to try to work on those distractions and work on trying to build up that ability to work with other things happening at the same time. Reading out loud is also helpful for the concentration part of it. It helps you focus on what you're doing. But again, when you have comprehension issues, you can't comprehend what you're reading, whether you're reading it out loud or reading it in your head, that part doesn't make a difference, to me personally at least. So when you're doing some of these different techniques, as you're working on them, trying to improve on them, keep in mind that not all of these strategies will work for everyone. Some people still have difficulties with other things. So when I'm doing my podcast and I have guests on, I have lots of notes. When I do this episode by myself, I have lots of notes. So if you're watching the video, you see all my notes in front of me, because I can't have this conversation without having notes in front of me. That's not to say that I am comprehending every word that I say, because I pretty much have it all laid out, all of my sentences, so that I can remember to go from one topic to the next and it flows smoothly. So sometimes my words sound a whole lot better over the radio or over my podcast, because I can stop and start recordings if I need to, and if my brain just kind of goes out the window for a moment. Comprehension goes along with that whole bit of being able to concentrate. Struggling to understand the spoken or written language is the definition of comprehension. So if you are comprehending what you're reading, what you're hearing, you are understanding, it makes sense, you can make decisions based on that information that's coming in. When that comprehension is affected, when you have a concussion, those conversations are more difficult to follow. So it's difficulty following the conversations. It's difficulty interpreting complex information. If you're trying to read directions on how to put something together, it can look like it's in a foreign language. can verify that one. I tried that one a couple times at home. I had to give it to my family members early on. Reading comprehension, again, when you're trying to struggle to understand what you're reading, that becomes a very big hindrance to getting back to work, to getting back to school. So earlier I mentioned that a quarter of those patients that had motor vehicle related accidents still were not back to normal at a year afterwards. So this is some of the things that are going on when you're struggling to get back to work, when you're struggling to get back to school, because you can't understand, you can't comprehend what it is that you're reading in a textbook, in notes and emails, whatever kind of any kind of communication that you have to do for work or school. What can this look like other than that? It can look like needing extra time to understand what somebody is saying. You might have to have people repeat themselves, not because you couldn't hear it, but because you couldn't understand it the first time. So you need to hear it a second time, or sometimes a third. Misinterpreting instructions or questions because you didn't catch every detail. And even as I meet with people, I try to take down lots of notes in important conversations. Sometimes I still miss something, so I will go back and read this. As I've been working with my speech therapy, some of the tricks that we work on is reading back. So it's a very important conversation. I take my notes, I read it back to make sure that I've understood what the other person is telling me, make sure that we're on the same page at the end of that conversation. That's also more likely to help me remember that because I've heard it, I've written it down, I've read it back. All of those things are tricks to help your memory in addition to that comprehension. It can look like feeling overwhelmed by complex conversations. Again, if lots of things are going on at the same time, that's going to be difficult. It can look like difficulty following storylines in movies or books. So trying to watch the new movie Wicked that came out the other day, trying to follow that. If you are struggling mentally to keep up with that movie, it could be related to that concussion that you had or that TBI that you had. Other terms, this one was kind of a cool one that I found. Alexithymia. I forgot about this one completely. That's the difficulty identifying and expressing emotions. Emotions are what connects us to other people. So if we have trouble identifying whether somebody's happy or sad or frustrated or upset, that's when we start having troubles with sarcasm, for example. So if you're talking with somebody who's being sarcastic, maybe you can't quite catch that that's sarcasm because you can't quite understand that part of that conversation. That's difficulty getting that emotion identified and then expressing them yourself. So some of those strategies to help with this. When you're reading, cover up the words that you aren't reading. Use a line guide if necessary. Sometimes it looks like the words aren't making sense. They're not in the same line. So using that line guide will help you to follow just that particular line that you're reading. Take breaks after 15 minutes. That might be a struggle if you're struggling with your memory part of it, but taking that break so that you're not overwhelming your brain and going on for too long of times. Continue working with speech therapy or get in with working with speech therapy. They have different apps that you can use, different game. It looks like games, but you're actually retraining your brain. And then slow down, take your time when you're reading, and especially important for conversations. Like I said, take those notes, read it back, those notes at the end of a conversation to make sure that you understood it correctly. Moving on to a different body part that you might see a problem with, your eyes, convergence insufficiency. So convergence insufficiency sounds like a really fancy term, right? But it's a condition where your eyes actually cannot converge appropriately when you're looking at an object. So you have two eyes. When you're looking at that object, your eyes both see an image. They connect that image on the back part of your brain so that it turns it into one. It flips it upside down. It does all sorts of things with it, but it turns it into one clear image. So when you're looking at something, you should be able to see just one of it. I remember when I first went to my eye doctor after my concussion, I couldn't clearly see things that were double, but I also couldn't clearly see just one object. And through all the testing that we did, we identified that I indeed did have double vision. And that's what part of this was the fact that I was seeing double or almost double because my eyes were not converging to make one single object. So that's one of the first symptoms, is that double or blurred vision. People might have eye strain or eye fatigue. They can get headaches because of the focus it's taking trying to create that one image. Difficulty reading and concentrating. So we just talked about concentration and comprehension. Sometimes that visual piece comes in and makes it more difficult to understand what you're reading because you can't see them. It actually looks like the words are moving when you're reading. I remember one of the first appointments that I had with OT, she had me reading letters across a list. And it looked like they were all over the place. I asked her flat out, I said, are these actually in a straight line? Because it didn't look like they were. So if you're struggling to read, if it looks like the words are moving on the page, this convergence insufficiency might be something that you have. Can you have this without a concussion? Absolutely. So I'm not saying that you have to have a concussion to have this, but if these are some of the issues that you're dealing with, probably a good idea to get your vision checked. So treatment with this, working with neurooptometry. So neurooptometry, neuroophthalmology. The ophthalmology part usually finds more of the complex cases with different visual issues. Neurooptometry can actually work directly with the occupational therapist, with the vision therapist to correct you as you go. So they will have you do different convergence exercises. One of them is a Brock string. So if you've ever seen somebody with this really long string that has a couple of marbles on it, it's not just because they like playing with marbles. It's because they're actually working on their vision. So you're working on converging on each of those identified marbles or beads on that string in succession so that you can form that single object. And then you work with it at different distances. Again, trying to get your eyes corrected at different distances. And then they might give you other sheets where it has two objects that look like half objects, but you're converging to make one. So like one of them that I work with is a stop sign. There's the post on one of them and then the actual stop sign on the other. And then you're putting them both together to make one object. And it's the tricks of using your eyes and getting them to work together to create that one single object that you're looking at. So big issue. Again, can it happen without a concussion? Absolutely. But if you had a concussion and you're dealing with this, please go see an eye doctor. Some of the other things that they'll work on with that is prism glasses. And I have gone through a couple different ones as my eyes have been changing after the accident because they do change and they correct. And sometimes this is a short-term thing and sometimes it's a long-term thing. So working very closely with your eye doctor, with your vision therapist is going to be very important for that. The next topic is a little bit more deep, so I'm going to give a good segue into this one. Chronic traumatic encephalopathy. Big fancy name. CTE is the abbreviation that you might see. Chronic traumatic encephalopathy is a rare degenerative brain disease that can happen as a result of repeated head injuries. This is where we get concerned about people having multiple head injuries over their lifetime because you have an increased risk of this happening. Is it going to happen to everyone who has multiple concussions? No. It's still, as far as we know, is a rare condition that you actually have your brain starting to break down because of all of the damage that's been done with multiple head injuries. The symptoms look like symptoms that we've talked about and that I will continue talking about in these ABCs of concussion: memory loss, confusion, depression, aggression, trouble sleeping, anxiety. I've said a lot of those already. Some of them are coming up. You can also have behavioral problems, mood changes, problems with thinking. Again, things I've talked about, so it might seem like it's more prevalent than it is. But again, still rare. It typically has two different times in life that it shows up, either in your late 20s or early 30s or later in life around age 60. And that's when we would start seeing these problems again because of multiple head injuries. One of the sites I looked at, it said who was the youngest, and age 17 was actually the youngest, but that's very, very atypical for somebody that young to have this chronic traumatic encephalopathy. Risk factors for getting this include being in those contact sports, typically most often football and boxing. So this is your Muhammad Ali's of the world. This is where they had those traumatic injuries over and over and over again. And then we have this degeneration that looks like Parkinson's. It looks like other things that are going on because the brain has been damaged so many times. There's a question of whether or not the age at first exposure to head impacts plays a role in it. And there's no distinct number that I could find in any of the articles that I was looking at. But it does increase the chance, the number greater the number of years of exposure. So again, the longer you have that you have repeated head injuries going on, the symptoms show up after many years. It's not going to be a month's type of thing. It's not going to be a day's type of thing. It's going to be several years after you continued to have repeated head injuries. And then there's some question of whether or not genetics plays a role as well. But again, that's not quite as clear as some of the other ones. The diagnosis of chronic traumatic encephalopathy is a clinical diagnosis, meaning when you go to your provider and you ask all these questions, you might get some head imaging, MRI, CT. None of those images are going to show this diagnosis because it doesn't show up on this diagnosis. This is kind of like the Alzheimer's diagnoses. It's a diagnosis that can only be 100% made on autopsy because there's a significant amount of this tau protein that shows up in the blood vessels on the deceased brain. So it's not something that we can diagnose with 100% confidence while somebody is still living. We can suspect that might be the case. And then how are we going to treat it? It's treating the symptoms. So basically that's how we're going to deal with that as we go along. So the best protection on this is prevention. That's why in all of these sporting events, we have new regulations. There are the Heads Up Concussion Program through the CDC, where coaches have to be trained so that they can identify it with the athletes. The students have to go through testing. They do the online testing typically before they get into sports to see what their cognition is now so that we can monitor if they do have something happen. Because again, the best protection is prevention. Complications, again, it can lead to dementia. It can lead to things like Parkinson's disease, movement disorders that looks like ALS. So that can get misdiagnosed also. So there's a lot of things in there that I would say kind of are a hot mess in that chronic traumatic encephalopathy world. So that's the quick and dirty on that one. The next topic I want to talk about is caregivers. So we often so much talk about the person themselves who has the concussion or the TBI, but we don't often talk a lot about the caregivers, the people that have to take care of or take over responsibility for somebody that's had a concussion or a TBI. So many caregivers for these individuals experience things like emotional stress, burnout, anxiety, depression, difficulty coping with the behavior changes of their loved ones, frustration due to their loved ones' cognitive limitations, and lack of understanding of the recovery process. My husband actually joined me twice now on my podcast to talk about this exact topic, about how our relationship was affected by my concussion and TBI, and how he had to take over more responsibilities in the household. So Brain Wellness is the name of my podcast. If you want to go listen to that one and get his perspective, because it was a very interesting perspective, getting that husband's point of view on it. For those of you that might not know what the symptoms of stress are, and I kind of say that in jest because we all are stressed. We should all probably know what this looks like by now. But stress looks like your neck and shoulders being tight, muscle tension anywhere in your body, stomach upset and nausea, constant aches and pains on the body, headaches, weight changes, sleep issues and fatigue, forgetfulness, difficulty with concentration, trouble making decisions, feelings of hopelessness, isolation, guilt, worthlessness, constant sadness and feeling blue is kind of the obvious ones there. Fear, worry, anxiety, crying spells, viewing problems as overwhelming, loss of interest in activities, hobbies, even sex. All of those things can be symptoms of stress. Some of those symptoms also sound very similar to concussion and TBI. So if you were in the same vehicle as the other person that got the concussion and TBI, you might be compounded by both of these things, stress as the caregiver, and you might have had a little bit of a concussion or TBI yourself. So it is very hard to watch. It's hard on the caregivers to watch their person's struggles. And I can validate that from having my husband on the show, having conversations with my husband, having conversations with my kids, because they actually came on for an episode last year of my podcast as well to talk about how it affected them and their part of their lives, because they also had to watch me go through all these changes. They had to pick up the slack for different things around the house because I wasn't able to do everything. So when you have somebody with a brain injury, whether it be a TBI or concussion, or in my world of treating patients that had stroke for so many years, that's a brain injury also. It's a different type of brain injury, but it's still a brain injury. When we're dealing with all of these, I always used to say that the whole family was my patient. It wasn't just the person that had the head injury, the brain injury, because everybody gets affected. And we give so much focus to the person needing the medical treatment that we sometimes forget to focus on the people that have to pick up the rest of life. And it's really, really important to take that time to focus on the caregivers because it can be very physically exhausting, whether the person needs physical assistance or if they have increased workload on the caregiver because they have to pick up so much extra, or maybe they have to pick up a second job because of finances. They're working very hard, very long hours, whether it be inside or outside the home, to help pick up the slack, take care of things because their loved one has this head injury. It can be very isolating for the caregiver because other people don't necessarily understand. We still have a lack of understanding in the general population about what happens with a concussion, how long it can take to recover, how it can affect everyone. So that caregiver isn't able to necessarily leave the house as much as they feel like they need to, or they might feel like they can't leave the house because they have to be there to support their loved one and the kids and whatever else is going on, even if they are given the okay to leave. My husband got invited to go to a hockey game recently, and he felt bad because he wasn't there to help me because I had to run the kids all over the place. And I told him it was very important. He needed that day to go and just be one of the guys and not have to be helping around the house so much because that's all he ever does. So it's okay as the caregiver to take that time and try not to feel guilty about taking that time because you need that as well. Changes in the person's behavior put strains on the relationship. Again, as I mentioned, my husband was on with me on my podcast. You can get some really great insight from his conversation from that, because it does just put it's a shift on the relationship. It's not the same. There are more needs from the person that has the head injury. There's more emotional misunderstanding on the person that has the head injury that puts a lot of emotional stress on the caregiver. Financial difficulties put a strain on the relationship. That person that has the concussion or TBI might not be able to get back to work. They might not be able to bring in the same finances that they did to help with support the family's budget. And that double income household is now down to one, essentially, because you don't have that person working. And that puts, even without a head injury, that puts a huge strain on a relationship. So when you add that head injury part to it, that's an even bigger strain. And then caregivers are often so busy caring for the other person that they don't pay attention to their own physical and emotional health and well-being. They're less likely to keep up with exercise. They're less likely to eat as healthy. They're less likely to get the sleep that they need because they're constantly worried about that other person and what else they need to be doing to help pick up the slack for that other person. So they're not taking care of their own needs. So how can we manage this? How can we help caregivers? There are support groups for caregivers, and that might not be for everyone. Support group has not yet been for me as the individual, but I do have a couple of close friends who also have head injuries that I can talk with them, and we air our frustrations with things, with appointments, with the lack of understanding of people around us, because that's somebody who does understand. So a support group for a caregiver might be just somebody else that they know who is a caregiver. That might be the support group that they need, but they might need that bigger support group as well. And there are several of them either online or face-to-face where you can get that support as the caregiver. And again, you need to take that time away from caregiving so that you can take care of yourself. It's like that whole thing back on when you think about anytime you fly somewhere, when those oxygen masks come down, they always tell you put yours on first before you can help anyone around you. Because if you don't get yours on and you're trying to help everybody else and you pass out, you're not going to be of help to anybody then at that point. So you have to put your oxygen on first. Caregivers have to do that oxygen first. Prioritize that self-care, get sleep, eat well, find time to relax. Those things are absolutely necessary in regular everyday life for people who haven't had a head injury. But again, if you are the caregiver for somebody else, whether it's head injury or whatever, if you're listening and you're caregiver for somebody, these are tips for you. So prioritize that self-care. Again, if your loved one had a concussion, you need to educate yourself on concussion recovery. Attend those medical appointments if you're able to, so that you can get information directly from the providers when your loved one goes to appointments. That's going to be the best information. Me as the patient, when I was coming back from all of my appointments early on in this whole journey, especially, I wouldn't remember the conversations that I had. So I couldn't keep my husband in the loop on what was going on because I didn't remember the conversations myself. So if you as the caregiver can attend those medical appointments, attend those conversations, keep notes on everything, not only will you be able to help your loved one better, you will also understand what's going on in the process. You can get your questions raised. You can figure out what exactly you can do to help support your loved one that will make everybody's life incrementally better. Communicate openly. So this one I kind of chuckle at a little bit because communication in a relationship is really important anyway. But as a caregiver, you need to be able to communicate your concerns and you need to be able to communicate about responsibilities. Because again, that person that you're taking care of, if they have a head injury, may or may not remember everything that they need to do. So if you have that open line of communication, nobody takes offense at it. It's going to just help that relationship so much more, and it will help the family in general. And if it all seems like too much, maybe the support group isn't enough, maybe taking that time for yourself isn't enough, you might need to seek professional help because you might need some counseling, some therapy, some medications yourself to get through this. I'm not saying medications are always the answer, but there is research to say that medications plus talk therapy is more effective than either one of those things alone. So coping with that stress of dealing with somebody's transformational journey as they go through this head injury recovery is very, very important. So make sure that you get the care that you need so that you can provide care for that person continuously. And then remember that every concussion is different. So as I talk about all of these different topics as we go through this ABCs of concussion, no two people will look exactly the same. So even my TBI warrior friends, as I call them, when we check in with each other, we may have had some of the same symptoms, but not all of them. So our paths are not identical as we go along. Once you've seen one person with a concussion, just means you've seen one person with a concussion. Does not mean you know what it looks like for everybody else, which makes it difficult for us as caregivers, as providers, to identify concussion because it can look so different in everybody. Yes, there are some classic symptoms, but those classic symptoms aren't present in every person that has a concussion or TBI. So it gets a little bit tricky to try to identify it. It gets a little bit tricky to identify what's the progression of recovery look like, because person A, person B are going to look very different in their recoveries. So just remember that concussion is different, that recovery time is different, and you can't pass judgments on, well, why aren't you getting better because Sarah over there is getting better and you're not. I don't understand why. It's because everybody's brain heals differently. Advocate for your loved one. As the caregiver, that's your responsibility to be the extension of that person when they cannot advocate for themselves. Again, that's where attending those medical appointments can be very helpful because you can ask questions, you can take notes, you can understand things better, you can help report things if the person's forgetting to report things. And then again, take those breaks when you need it because that, again, is very, very, very important. So next topic. Again, I could probably go on any of these for long periods of time, but real quick and dirty on some of these. Next topic, I'll get into a little bit before the break and then I'll finish it afterwards. Clumsiness and coordination. I was going to have these as two separate topics, and then I realized they're pretty much the same thing anyway. So I put them together. Clumsy or awkward movements following a TBI are very common, actually. It can look like trouble with balance. It can look like dizziness. It can look like fine motor problems. So writing, coordinating, sewing, doing little things with your hands. If you work with tools on a regular basis, you might have difficulty working with those tools. If you do archery, I struggled with my archery for a while. So any of those things can be seen. What causes the problems with coordination and clumsiness? It can be changes in your reflexes, changes in sensation, or changes in strength. What does it look like real quickly before the break here? dropping things easily, messy handwriting, difficulty applying makeup or doing your hair, difficulty tying your shoes, difficulty organizing things. All of these can be related to that clumsiness and coordination. And I will talk about it more after this last break here. Welcome back again, one last time for today. Again, Mandi Dickey on Recharging the Human Battery here on AM 950 radio. Excuse me, brain is not functioning well today, as we were just talking about actually on the break. Some days I have better days than others with my words, and I've said more times than I like to. But that is not related to the clumsiness and coordination that I was talking about before the break. So let me finish up on that topic. So again, clumsiness, coordination can happen after a concussion. It can look like dropping things, that messy handwriting, difficulty applying makeup or doing your hair, trouble tying your shoes, trouble organizing things, like manually organizing things. When I talk about organizing things, it can be a concentration issue where you can't concentrate to organize it, or it can be physically unable to organize things well. And that's the clumsiness part of it, where you can't coordinate your movements enough to organize things as you want them to. Maybe things fall over when you're trying to set them up, something like that. It can affect your manual dexterity when you're doing manual work or playing sports. Like I said, I was having difficulty with my archery because trying to coordinate my movements was really difficult. Also, again, doing any kind of manual work, if you do crafts, if you do any kind of artwork, that can be difficult if you have problems with this manual dexterity and coordination. Again, it can be a short period of time that you have these symptoms. It can be a longer period of time that you have these symptoms. And it can be complicated by visual problems. So that convergence insufficiency that I talked about earlier before the break, if you have troubles focusing and getting your eyes to converge to see one single object, it's going to make things like sewing, drawing, writing, any of those things more difficult to do with your hands because you cannot see what you're doing as well as you need to. How can we test this? When you go see your provider, they might have you do things like touch your finger to your nose and then touch their finger. And that's looking at coordination based on left hand, right hand. So we're seeing how well you can move that way. We can have you do things like rapid alternating hand movements where you put your hands down on your lap and then you flip them over and back and forth from the front and the back of your hands, doing those kind of rapid movements with your fingers. And again, this is radio. I always forget you can't see what I'm doing, but I'm moving my fingers from one to the other. So having those little movements that we can do on those exams, that's why we have you do those funny things when you come in to see us as a provider, because we're looking at that coordination. How well can you coordinate those movements? In neuropsych testing, one of the coordinations things that they do is have you pick up these little metal pegs and put them in a block in different holes in various shapes and sizes. So you have to do that, again, right hand, left hand, and they time how quickly you can do it. So they look at your coordination in that regards. How do we work on this? Again, it's not necessarily a permanent thing. For some people it is, but physical therapy, vestibular rehab, light aerobic exercise, things like we offer at Hypercharge, the exercise with oxygen therapy versus hyperbaric chamber. If you can find one of those, same kind of thing. That's also going to help rebuild some of those neural connections in the brain so that you can have better coordination. And then physical rest when you are overstimulated, because the more you try to push yourself beyond hitting that wall, as I call it, the more problems you're going to have with any of your symptoms after concussion. And then the last topic that I have for you today is coma, because that also comes up. That's a concern that a lot of people have, that they don't want their person to fall asleep after they've hit their head because they might slip into a coma. Well, slipping into a coma is actually not a common risk after concussion. Only about 10% of those with concussion even lose consciousness to begin with. So it's a very small number. Unconsciousness, coma are often used interchangeably, but there is a little bit of a difference. There's an international working group that came up with a definition that said the patient that does not follow commands and they don't open their eyes either spontaneously or in response to noxious stimuli. The bigger problem with somebody falling asleep is that they're going to sleep through some of those more severe symptoms that let us know they had a really bad head injury. So again, I could go on and on and on. Why I do this is to educate you guys on what symptoms to watch for, what symptoms you might see after a concussion, because I don't think we all are as comfortable as we should be with what it looks like, how to treat it, how to understand others. Thank you for being here today. We will see you next time.